Hello.
Hello, is that Jenny Long?
Yes, speaking.
Hi, my name's Dr. Steele. I'm calling from the Royal Free Hospital.
Okay. Is anything wrong?
I'm calling for an update, just to discuss with you how your father's doing, and just to get a bit more information if I can. Is that okay?
Yeah, that's fine. That's fine.
Okay, how are you today?
Oh well, I'm okay. I'm worried about him, obviously.
Yeah.
But, yeah, I'm okay.
Can I just check before we start talking properly? Are you somewhere quiet and relaxed that you can chat now, or do you want me to call back in a little while?
Yeah, no, that's fine. I'm at home.
So, just to bring each other up to speed, can I check what you've been told so far, and then I can fill in any gaps and tell you what's been happening?
Yeah, well, I know he's in the hospital with COVID. I know he's having some oxygen and medication. The nurse I spoke to yesterday said he was maybe looking a bit brighter. So
Okay.
yeah, that's what I know.
That's what you know so far. Okay, so that's right. He has got a positive COVID test, and so we are giving him oxygen and medication to help with his lungs. And we're giving him two particular medications which have shown benefit from the virus for those patients needing oxygen. So we're hoping that that's going to be helping him. And we're going to be watching him very closely, making sure he doesn't develop any sort of further infection in the lungs. And if that was the case, we could potentially give him some antibiotics. But we're keeping a really close eye, making sure he eats well and drinks well. And we're hoping he will improve, but it's early days, so I think we're not quite sure yet how he's going to do. So I think we just need to take it a little bit at a time.
Okay.
I do think we need to think about what he would want and how you would want us to also care for him if he did get worse. I hope he will get better, but we do need to think about, the different possibilities of what might happen, so that whichever eventuality, we look after him the best way possible for him.
Okay. Yeah.
Would it be okay if we talked about that now? Do you have any questions so far? Because I've already told you quite a bit.
At the moment, he is doing okay. You just want to go through if he gets worse.
Yeah, if that's okay. Okay, I am sorry that we're doing this over the phone. I know it's really hard to have these conversations like this and not in person, and I would never want to do this without seeing you, but unfortunately, this is the situation we're all finding ourselves in. So
I know. It's hard for us not to be able to come in and see him as well.
Yeah.
Because we need to see him every day. So
I know it's hard, all this lack of contact.
Yeah.
So, by the way, if when we're talking, I can't, we're not with each other. So, if you do want me to pause or you do want to just take a minute, that's fine. I'll just stay on the phone and you can take the time you need if you just need to sort of think for a moment. So,
thank you.
So, did he ever talk to you about the kind of treatment he would want if he got seriously ill?
Well, no, but I think he would want everything done. He's not that old, and before this, he's got a few problems, but in pretty good shape, really.
All right. So if I can just talk to you about the different options for treatment that we think would benefit him, and then we can just go through our different sort of options of treatment. Is that okay?
Yeah, sure.
Yeah. So I think despite what we're doing now and despite us trying our very best, there is a chance his breathing could get worse. If things do unfortunately get worse, I've discussed with my consultant as well, and we think he may benefit from a different type of oxygen mask which pushes air into the lungs. Essentially what it is, it's a very tight fitting mask, and the oxygen is delivered to the lungs under very high pressure. Sometimes that can be quite uncomfortable, and patients don't always tolerate it. But if your dad doesn't do as well on the standard oxygen, we think we should try this to see if it helps get more oxygen into the body and see if he can manage with it. What are your thoughts?
That sounds like a good idea.
Okay.
If you need them.
I think for your dad, we are going to try and do everything we can that we think is going to help to get him better. But we do have to consider that he may become sick enough to die. I'm really sorry to say that to you now, and I'm really sorry I'm saying it to you over the phone, but that is a possibility.
I mean, you're not talking to me now because you think he is going to die, are you?
No, not at this point, but I think it's something that could happen. Are you okay?
Yeah.
Are you okay for me to continue, or do you need a minute? Fine. So, I think unfortunately, if your dad did continue to get worse, despite all our treatments and all our sort of best efforts possible, I don't actually think for your dad's case, putting him on a ventilator would stop him from dying.
What you're saying, you wouldn't put him on a ventilator?
I don't think it would change the outcome, no.
But they put people on ventilators all the time, and they get better. I mean, why wouldn't you do that? Why wouldn't you do everything you can?
So I want to give your dad the absolute best treatment I can for him, and I will do everything I can to get him well that I think is going to work. Your dad, unfortunately, has other things going on in the background. So his heart is not as good as it once was when he was a bit younger, because he has had a heart attack and he has got other heart conditions. And again, you mentioned he had COPD, and his lungs are not as strong as someone else who doesn't have these issues.
It works sometimes, though, doesn't it? Isn't there? I mean,
for patients who have not a lot else going on, and we think that there's a chance that their lungs can recover and their heart can cope with it all, then yes, some patients do improve. Even those that are pretty fit to start with often don't improve, and many of those patients do die. So for someone who is already not, unfortunately, so strong and has got other medical things going on, putting him on a ventilator, I really don't think, and I have talked to my consultant, it's not my decision alone, and the rest of the team. I don't think it would change the outcome here. I'm fairly certain of that. It doesn't mean that we're not trying our best. We are trying our absolute hardest for him. I just don't want to do something for him that I think is not going to work, and to put him through something that I don't think is going to benefit him.
Okay, so he wouldn't, if he gets worse, he won't go to intensive care.
No, I don't think it would be of any benefit to him. This is worst case scenario that I just have to talk through with you. I'm so sorry I have to have this conversation with you, but that's just, the situation we find ourselves. We have to plan ahead. Jenny, there is one more thing I do want to talk to you about. In terms of resuscitation, for the same reasons that I've talked about with the ventilation. If unfortunately his heart does stop and he dies, trying to shock his heart back and trying to restart it is not going to change anything. It wouldn't work, I don't think. So I don't think we should be resuscitating him for the same reasons that I mentioned with the ventilation. I don't think it will change the outcome.
But I mean, if there's a chance it would help him get through that, surely you should try.
If we were to try and restart your dad's heart, it wouldn't change what's going on in his lungs and the rest of his body. And because if he does die, it will be because of everything else going on in his body. Restarting the heart is not going to change any of that. So I don't want to put him through something that isn't going to change. He would still die. So I just don't want to put him through something that isn't going to help him. I'm so sorry.
I mean, if you're sure it wouldn't help him,
I'm so sorry. I am sure. I'm still hoping he will get better, and I'm still hoping that with all our efforts we can get him out of hospital. So I am going to try my absolute hardest to get him well, and I will do everything I can to help him that I think is going to work.
Thank you.
I'm sure this is an awful lot to hear. If you have questions and you want to talk to me again, just to tell you again, my name is Anna Steele. I'm one of the doctors on the ward, and I'm here each day this week. So you might put the phone down and find you have 10,000 questions. So please just call me back. I'm here and I can talk things through with you.
Thank you. Thank you. I mean, you'll be seeing him today, yeah?
Yeah.
Please, could you just tell him that I really love him?
Of course.
Thank you.
You're okay.
But no, I'm fine. Thank you very much.
Thank you so much for talking to me, Jenny, and thank you for giving me your time. I know it was really not very easy, and it is worrying, but we are doing our absolute best for him.
Thank you.